So I'd just like to thank Dan and all the planners for this symposium today. I'm going to kind of switch the focus of the topic today. I'm not going to be talking so much about resident education and focusing more on patient education. So this is called, like Dan mentioned, Communicating the External Beam Experience, Perceived Benefits of a Novel Graphic Narrative Patient Education Tool. So as physicians and medical caretakers, we're well aware of the importance of the relationship between a physician and a patient. Effective communication is central to the patient-physician relationship, literature suggests that effective communication with patients has been beneficial on medical outcomes, including lower rates of anxiety, pain, psychological distress, and even important in decreasing the financial burden on the medical system. Health literacy has also been shown to be an independent factor in patient health itself. So traditional health education for patients who are receiving radiation therapy has generally been through oral discussions between the patient and the physician, as well as written materials. And we know national guidelines recommend that patient education materials readability should be somewhere between the 5th and 6th grade reading level. These recommendations come from the CDC as well as the Institute of Medicine. But then when we look at the patient education materials that we provide for our students or for our patients in radiation oncology, literature suggests that these are actually at least at the 10th grade reading level on average. So our goal was basically to design a novel patient education tool using a graphic narrative form to improve patient comprehension and understanding compared to the standard text-only patient education materials that we currently provide for our patients. So we wanted to create something that basically started at the initial consult and took patients through the entire treatment experience, and then even sort of explain what happens at follow-up. So after creating this, our goal was then to assess whether physicians and patients would actually find this to be useful, and does this ultimately decrease patient anxiety when they're going through the treatment process. Radiation oncologists from the University of Chicago collaborated actually with the Illinois Institute of Technology, the Institute of Design, a graduate class of 12 designers and 1 advisor, composed of 2 project managers, 2 integrators, 3 researchers, and 2 illustrators was created, and the designers conducted structured interviews of patients, patient families. These patients were either currently on treatment or recently completed treatment, patient families, and then radiation oncology clinic staff, so the therapist, dosimetrist, physicist, nurses. So it wasn't just a physician sort of directed interview process. So these interviews were coded for themes to uncover stakeholder-based insights, leading to design principles that sort of designed the design of our discussion guide. The CEBRE discussion guide basically comprehensively covers the external beam radiation experience, like I mentioned, starting with the initial consultation all the way through follow-up. And then in order to sort of personalize this, the discussion guide, if you take a look, actually has a My Information section. It's sort of on the back panel that includes basic patient-specific information, so site-specific, and then also clinic-specific. So we wanted to make it so that it wouldn't just be specific to the University of Chicago. This was done to basically try and create or facilitate not just sort of a didactic sort of interaction between the patient and the physician, but more to tailor a discussion and then to allow the patient to go home and have, some sort of written record of the discussion that we had. I think, many of us as physicians feel that, and also literature sort of suggests that when patients come in to see us, they're kind of overwhelmed with the amount of information. When we asked physicians on our survey how much information they think patients retain, it's often less than 50%. So this is kind of a way for the discussion to be tailored to the patient, but then also for them to have a written record of kind of what was discussed in a way that's much more accessible to them. So like I mentioned, the class was composed of 12 students and one advisor. And you can see that a lot of research actually went into this. Over 300 hours of just primary research went into designing this. And then a total of more than 700 hours, and this does not include any of the time that the MDs spent to sort of put this together. So with these sort of goals in mind, we set out to create this discussion guide. Our requirements were basically that the content should be applicable to a majority of radiation clinics, so not just the University of Chicago. We wanted it to facilitate a discussion like I talked about. Other things, just in terms of being practical, we wanted it to be practical to actually produce it, so low cost of production, and then easy way to distribute to patients. And then also, like I mentioned, we wanted to be able to customize it, not just to the University of Chicago and not just to a specific site. So we wanted to be able to customize it to a specific disease site. We also, like I'll show later, we sort of created anatomical descriptions for patients to kind of understand exactly what site they would be treating. And then ultimately our goal is to distribute this not just within the University of Chicago system, but also nationally and internationally. So this is kind of a few pictures of the process that we went through. So these are the design students kind of speaking with the therapist, going through what a simulation might be like, sort of the discussions that we had as a class, and then we came up with a sort of written and drawn prototype, as you can see here, which was then translated into a graphic prototype. This is the black and white version, that kind of where it all started. So then in terms of analyzing our work, the first thing we wanted to do was make sure that it met our goal of readability. So we had set a goal that we wanted it to be at a standard reading level less than the 6th grade reading level, which we did achieve. It measured on the Fresh-Kincaid scale about a 5.4, so we did meet that. We met that goal. And then also we wanted to demonstrate once again that this was actually usable and that it would ultimately decrease patient anxiety. So we designed a pilot study to determine the perceived benefits of this discussion guide. We created a survey, one for physicians, one for patients, which included the systems usability score as well as the Spielberg State Trait Anxiety Inventory, the short form. These were both modified to fit sort of the radiation oncology questions that we were asking. We asked patients who were on treatment or who were in active follow-up, and then also practicing radiation oncologists. I think a few of you guys might also be in the room who filled out the survey. And then we used Likert type scores like many of us to report as the median for the scores that we were reporting. So here, what you have is our final product, version 10. This is the mini one. The one that we're actually trying to distribute is actually, I guess, almost twice that size. But as you can see, this is, like I mentioned, the individualized My Information section. I think kind of one of the most interesting parts of it is that at the bottom it has a treatment calendar, so patients can kind of mark off, how far along they are in treatment. I think it's kind of, it's good to see, how far along they've gotten. Not just, every week in your weekly OTB, your patients ask you, oh, how many more treatments do I have left? Like, they actually have a record for themselves, which I think is really nice. And then these are just pictures of each individual panel. So it starts at the initial consultation, and then goes through simulation, planning, treatment, and then after treatment. And then here's the My Information section. So like I mentioned, we did create these anatomical drawings to put in in the area where the doctor's sketch pad is for patients to actually understand the site that's being treated. And then also in here is at the panel all the way at the other end is a place for each clinic to put their own individual information. So we have labels here that are created specifically for the University of Chicago, but in order to distribute this on a national level or international level, we wanted to make it so that different clinics can put their own information there. So in terms of our results, like I mentioned, the CEBRE guide came in at about a 5.4 reading level. We distributed our survey to 34 patients and 12 radiation oncologists. And then in terms of the responses that we got, both physician and patient responses were concordant in that they all thought that, or showed that, that they thought that the CEBRE discussion guide was useful. So on the systems usability score, it was a 4 out of a scale of 1 to 5, and then for the modified STAI, it was a 3 on a scale of 1 to 4, where 1 was where for the SUS 1 was disagreed to strongly agree in terms of how usable and whether or not it would decrease patient anxiety. So compared to a text-only pamphlet, the graphic narrative component was rated as quite useful by both physicians as well as patients, and then providers reported that they were extremely likely to use CEBRE. So on a scale of 1 to 5, how likely were they to use it? Extremely likely. So in terms of our conclusions, the CEBRE, or the Communicating the External Beam Experience Discussion Guide, is a patient-accessible, practical education tool that warrants further investigation in the radiation oncology clinic. And in terms of what we plan to do with this, so we want to implement the CEBRE discussion guide at the University of Chicago first, and then on a national level. We'd also, or at pilot sites, and then ultimately on a national level. We want to validate this in a prospective fashion. And also another thing that we're working on is developing discussion guides for other modalities, so brachytherapy, SRS, and SBRT. So I'd like to thank all my collaborators, and then we did receive a grant from the Boxbaum Institute here at the University of Chicago in order to create this discussion. So if anybody has any questions.